diseases?
Some of the most common diseases are the venereal diseases. Syphilis and gonorrhea. Herpes is becoming more and more prevalent, and we do examinations for the isolation and identification of herpes virus.
Well, one of the places where I first met you was when you were starting the herpes screening and testing.
That's correct.
How has that been coming off so far?
It's coming along very good. Our isolation rate from the sources, both in the community, the health department, and the outpatient clinic, is roughly around 20% of those specimens we receive, we find the virus.
So 1 out of 5 times you're finding it on when doctors send little specimens over.
That's correct.
Right. Besides the communicable disease testing for diseases like venereal diseases, tuberculosis, and the many other communicable diseases, what else do you test for here at the Sutter County Health Department laboratory?
The other measurements that we do here are for environmental health. That is the examination of water to see whether it is drinkable or not. And that's in conjunction with the Environmental Health Division of our health department.
Does someone actually go out and test well samples around here?
Yes, the Environmental Health Division does that, and they also private individuals can bring samples in here.
Can I go to my sink at home in North Yuba City, take some water and say I'd like to bring it over here and see what the water's like?
In actuality, no.
Aha, okay.
It does demand a little bit more than that. The water must be brought in a prescribed container in order to neutralize the effect of chlorine that might be in the water.
I see.
So we won't get false results.
But if someone would want to call you here at the health department, you could give them the information about the proper way that they could test their water if they suspected some serious problem.
That can be obtained. The best way to obtain it here would be through environmental health.
So they call here and ask for the environmental health department?
That's right.
Great.
Excuse me. They can call environmental health directly. That's 671-1120.
671-1120.
Right.
Good. Now, can you also test for these things we've been hearing about a lot in the news about toxins that are getting into the water supply from service station tanks that are leaking underground, or toxic waste that may be in the ground? Is that possible to test for?
No, that isn't. That demands a much more sophisticated testing system in laboratory. And perhaps the only places where those things can be tested would be through the state health department laboratories, both in Berkeley or in Sacramento.
So occasionally, I suppose you do have to send things to those labs from here?
Yes. Those laboratories, both in the environmental health measurements and communicable disease measurements, act as our reference laboratories.
I see. Besides then communicable diseases, environmental health, what other things are you doing here?
We act as a reference laboratory in the field of microbiology for local laboratories. And we also...
What do you mean exactly by that?
Okay, when they reach a point in their attempts to isolate an agent and they do not have the abilities to go any further, they can send the culture, the isolate, to us.
So an example might be if a patient's in the hospital and they're suffering from some disease, the doctor can't figure out what germ might be causing it, and he knows that there's probably a germ causing it and something's growing and the hospital lab can't figure it out. They could help, they could bring it here and you could help them with that.
That's correct. And the other function that we have is as a consultant to the medical community as a whole. Try to explain the tests that we are doing, the interpretation of the tests, and perhaps what tests can be done to best find out what the agent is that's causing the problem to his patient.
The staff of the Sutter County Health Department did an excellent job tonight showing us some of their facilities in Yuba City. Let's meet again with 2 very important members of the healthcare team from the Sutter County Health Department. My guests tonight are Health Department Administrator Mr. Alan Leavitt and the Director of Nurses Barbara Moberly. Thank you for joining me tonight here on the Medical Explorer.
Thank you for inviting us.
My pleasure. Mr. Leavitt, I always like to know a little bit more about the health or educational background and training of people on our show. Where did you go to school?
I did my undergraduate work at the University of California at Davis in political science with a specialty in local government. And my graduate work was done at Cal State Hayward with a master's in public administration.
So you really have a very complex administration background then.
Right.
That's fantastic. Well, we certainly need that. Barbara, how about your nurse's training?
I received my nurse's training with a BS in nursing from Texas Christian University in Fort Worth, Texas.
How did you end up here?
Long story.
Well, maybe we'll... was it just personal reasons or professional?
Well, here it actually was personal.
I see. Review, Alan, with us some of the services offered by your health department.
Well, the health department services are varied, and they range from our public health lab, which you have seen, to environmental health, and we have children's health services, which are screening for infant and children to detect disease. We have communicable disease control. We have field nursing, in which our nurses, public health nurses, go out into the homes and into the field doing investigations. We have family planning services, immunization services.
They sure are vast. I mean, they just feel like we're going to keep going for the next 10 minutes on those, so we better hold on. There's endless services. Everyone should realize that. Barbara, who's eligible for these services?
Just about anybody in Sutter County is eligible for the services. There is a fee for most services, and it's charged on a sliding fee scale.
So if people have more income, you'd expect them to pay reasonable fees, and if they don't, you'd reduce the fees, basically, which is a very nice service the county offers. How do these medical services differ from those of a private doctor, Alan?
The private doctor is concerned with acute care. The public health department is concerned with preventative health services, in that we are trying to prevent the spread of disease. In some areas we will treat also, such as TB, VD, where we treat the patient, but we also are concerned with the spread of the disease, and we work both sides.
So you'd certainly recommend that people in our community have established relationships with private doctors and not use the health department as the source of medical care.
If they were to come to the health department for acute medical care, we would refer them to either our outpatient clinic or to a private physician.
I see. Good. Having the great enjoyment of liking to go to restaurants, I always want to know more about the inspection activities that your department serves in looking at restaurants in the community. Do you actually have someone going in there and seeing what's going on?
Correct. We have a public health sanitarian who has the responsibility of inspecting each food establishment in Sutter County, not only restaurants, but bars. If a gas station sells food, they also have to have a permit to sell that item.
Can we be pretty much assured that the restaurants operating now have been inspected and are reasonably clean?
We hope so. We get out, we try and inspect each food establishment 4 times a year. And of course we go out on any complaint and any other problem, such as if they've had a grease fire or any type of problem in the restaurant, we will go out and inspect it.
Maybe you could arrange for the Medical Explorer one day to go out with one of these inspectors and actually see one of these restaurants.
That would be fine.
That would be fascinating, really. Where does all the money come from for you to pay your staff and the sanitarians and the nurses? How does that funding come about?
Our funding is divided between the state and local tax dollars, county tax dollars. Approximately 60% of our funding comes from the county, and approximately 40% comes from state funds.
I see. So tax primarily is...
Primarily taxes.
Right.
The patient fees pay a very small portion of
they
our...
probably pay for the paper that you're writing on when you're in the office.
About it.
I know one manila chart can cost 30 or 40 cents, which can really add up when you think about the number of people that you see.
Well, we figure our administrative costs for records at about $6 a patient.
$6 per patient?
$6 per patient by the time you put in the clerical time and everything that's associated with it.
It's amazing. Barbara, is it true that parents are failing to immunize their children against many of the contagious diseases in our community?
We don't feel that that's true in Sutter County at all. The immunization levels in Sutter County range anywhere from 90 to 95%.
So people are really
People are
involved.
following through with that, yes. It's not. We don't feel it's a problem here.
Do schools require this?
It's required for certain immunizations are required for schools, and they're the ones that are the major childhood diseases: measles, mumps, rubella, diphtheria, pertussis, and tetanus. And those are all requirements for the schools.
If someone wants to use the health department as their source of these immunizations, how do they go about doing that?
They would come to the health department any Wednesday afternoon between 2 and 4, and that's when our immunization clinic is.
I suppose they could also call up and get more information as well. Do you have that phone number by any chance?
671-1140.
671-1140. Great. Very good. I'm just curious, are there times when adults would want to be immunized against certain diseases?
Yes, adults need to be immunized against tetanus on a periodic basis, either every 10 years or if they are injured every 5 years.
Can that be done also?
That can be done there, yes.
Great.
We also do the skin testing for tuberculosis, which is done on children and adults, both at the health department, which is a way of screening for tuberculosis, and some schools or jobs require this. Some of the overseas shots, there are very few required now, but we do give those, except for yellow fever.
Well, the next time a patient walks into my office and wants a tetanus shot, I'm going to send them across the street to you, which is very convenient. I didn't even know about that service. That's great. There's been a lot of publicity about dangerous chemicals getting into the drinking water of cities across the United States. Not many problems around here, but I remember when the flooding was occurring last year, there was some problem with some contamination. How are we protected against these things in Sutter County?
Okay, the primary protection in drinking water is by testing the water and continuous testing to make sure that the water is safe to drink. And there have been changes in the past, 3 or 4 years in the requirements to test water. The health department, the Sutter County Health Department, tests water for bacterial content only and not for chemical content. But if there are concerns on chemical content, the State Department of Health will do the testing for us.
Does that happen once in a while?
Yes, it does. The state automatically tests all water systems of a certain size. If there are 5 or more connections, the water system is required to have a permit, and it will be tested.
Now, my home is on the, what's it called, the Hillcrest water system, which is different than the city water system in Yuba City in Sutter County. So we can be assured that someone's checking that water periodically?
Because of the size of that water system, the state tests it at least twice a month, I believe.
Great. Well, that makes me feel better. I've seen all these things on 60 Minutes and other shows about gasoline tanks leaking underground and gasoline getting into people's water systems, and I just hope it never happens here. But I guess there has been no evidence of anything like that happening.
There has been no evidence of it.
Okay. Now, the Sutter County Primary Care Clinic is different than the health department. Is that correct?
That's correct.
And what do the two do? How do they work together?
The primary care clinic is the, if you would say, successor to the county hospital. When the county closed the hospital, they maintained the primary care clinic. And it is, in effect, our medical doctors who provide acute medical care, whereas we said before the health department is responsible for preventive care.
So the primary care clinic could actually function as the private doctor for patients?
It is essentially the private doctor for county patients.
Often are those Medi-Cal patients or MIA patients?
MIA, Medi-Cal,
or anyone.
Indigents, or anyone. We take private insurance patients, and we have quite a few that come in.
I know that those doctors are very good over there and that people should consider those services if they're looking for a physician.
Well, we feel that we're fortunate in the 2 doctors that we have.
Great, great. I thought there were more than 2. Did something get cut down here?
Well, we have 2 doctors that are on staff full-time, and then we have 6 specialty clinic doctors.
Oh, okay, that's where I thought about that. Okay, good. Now that would be paid for by these services such as Medi-Cal or private insurance, or people would just use their own money to pay for those services?
Correct.
So the taxpayers, in one sense, are not truly paying for that unless they're going through the Medi-Cal system, and then they are paying for it. What a mess. It's just, I tell you. Barbara, I'd like to get more into the nursing work. What's your favorite aspect of your nursing work over at the health department?
I think my favorite part of public health nursing is the diversity. You have so many different areas to be active in, plus the people you deal with. You deal with all ranges of people, and you deal with the whole family.
Could you tell us a little more about some of these public health aspects of nursing?
Well, you deal in clinics, you deal pretty much with preventive and teaching care for children and adults. In the home visits, the field visits, which our field nurses do, you deal with the whole family on any range of things, from nutrition to prenatal care to how to bathe a baby, all ranges of care.
Do public health nurses occasionally feel that they have a little bit more autonomy in what they're doing? They have a little more control of what their activities?
The independence is very nice.
Right, that's the word I'm looking for.
A lot of people like the independence.
Right, rather than being
totally supervised
at a hospital
every single minute in a hospital or something like that. Yes.
We should mention, of course, that a lot of the nursing work where there is supervision can be very enjoyable as well.
Absolutely.
Just certain people like the independence of public health nursing.
I think I've enjoyed every phase of nursing I've ever worked in, but public health is my favorite.
Great. Let's again tell our viewers how they can get more information about the health department? What would they do?
Could call the phone number at the health department, which is 671-1140. Ask to speak to one of the nurses, or just talk to one of the clerks if your problem isn't medical. If it's a medical problem, you want to talk to one of the nurses. The clerks can help you with the scheduling, with appointments, or any of the other information you might need.
Great. Well, thank you. Unfortunately, our time seems to be flying by here. I'd like to thank Mr. Leavitt and Nurse Moberly for taking time out of their busy schedules and for coming over and joining us tonight on the Medical Explorer. Thank you very much.
Thank you.
I'd like to invite you to write to me at my dermatology office in Yuba City with your suggestions for areas and people that you'd like to see on this program. The Medical Explorer, as you know, is a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me at 367 Del Norte Avenue, number 4 in Yuba City. In my next program, The Medical Explorer will take you behind the scenes of more interesting frontiers of medical care practices in the Yuba City, Marysville area. Till next time, I'm Dr. Robert Peppercorn, your Medical Explorer. Thank you for joining us tonight, and have a good evening.